Come in.
Hello. Hi. I'm Isaac Johnson. I'm one of the physicians here at Pondview Nursing and Therapy Center.
I'm Christine, Lynette's daughter.
I guess that makes me the patient. I'm Lynette.
Well, nice to meet you both. I did bring one of your nurses from the care team. Would you like to meet him?
Yeah.
Awesome.
Hi, Lynette. I'm Alex, the nurse from your care team.
Yeah.
I'm Christine, Lynette's daughter.
I'm sorry. I probably won't remember your names.
And could you speak a bit louder? She has been having trouble hearing recently.
Yeah, I've gotten old overnight.
Great to meet you both. How are you settling in?
Okay.
Mom is still feeling some of the effects from the stroke, but she's determined to get back to normal life as soon as possible.
Yes.
Well, we're glad you're here. We're going to do everything we can to make sure you're comfortable, okay?
Thank you.
From the hospital report, it says that you're still having some problems with weakness on your right side. Is that correct?
Yes, this right side still feel weak.
Okay, okay. It also says that you're still having problems swallowing and speaking. Is that correct also?
Well, speaking has been hard since the stroke, and I think people, you might think, can understand me.
You're doing great, Mom. It's just honestly better each day.
Oh, it's good because I like to talk a lot,
Yes, you do.
especially about food. I have not had regular food since the night before the stroke. Can I get some food, like something normal that tastes good?
Well, hey, I like talking about food too. What are some of your favorites?
Oh, pizza, fried chicken, what about you?
Pizza is my favorite. With a lot of veggies, I'm a vegetarian.
No meat?
No meat. It's healthy for you. You should try it.
No, thank you. Can I get something else besides this applesauce?
It's great to hear you're hungry. Can you first tell us if you've had any trouble eating or drinking any specific types of foods?
I would really like some pizza or some fried chicken.
Mom.
I respect your determination, but it's probably better if we stay somewhere between the applesauce, pizza, and fried chicken. Something you can chew and swallow easily.
My mom is having trouble chewing and swallowing. She's been having tooth pain. She had a back molars taken out about a month ago. And also her care team at the hospital was saying that we need to watch her diet to help with her diabetes and general health.
I'm fine. I would eat this way my whole life.
Seriously? Okay, so Mom is a very strong and independent woman, which is great, but she's also set in her ways. Mom, we have to make sure we get your diabetes under control. I'm scared.
Oh, honey, don't be scared. I'm gonna be alright.
I just don't want this to happen to you again. You're too young.
I'll try. I'm scared too. I'll try, I promise.
Good, because I want you around for a long time.
You be careful what you wish for.
Lynette,
Good.
it's great to hear you're willing to try some changes to your diet. We'll have you visit with our care team. They can help you with that. Our dietitians are very good at finding a balance of healthy foods that taste good as well.
That's healthy food that tastes good.
Definitely.
Oh.
And we have some very excellent dentists on our staff here. They can come and take a look at your teeth.
Oh my gosh, that'd be great. So you haven't been to the dentist in a while, no? I mean, her job, she doesn't get insurance with working at dental insurance with working at the restaurant. Would we be able to see a dentist today? I'd love to hear what they have to say in their recommendations.
Absolutely, absolutely. What I can do, I can relay this information, and hopefully we can get someone by here maybe later this afternoon. Okay.
Yeah.
Lynette, it's important for you to know that we're going to do everything we can to help you through your recovery, to make you feel as comfortable and pain-free as possible.
Thank you.
I also think it might be a good idea if we have an occupational therapist and a physical therapist come by and see you. The physical therapist, they're going to help you compensate for the weakness that you're feeling on your right side. And then the occupational therapist is going to help you manage your everyday tasks throughout your therapy, even when you're at home.
So I will put in a request for visits from other members of our care team, including a dietitian, dentist, and physical therapist and occupational therapist.
Awesome. Thank you, Alex.
In the meantime, is there anything I can get you, Lynette, besides pizza and fried chicken?
You're too good. I think there's some soup.
It's a great idea to ask the dentist and dietitian about. I will stop by with food after they visit.
Okay,
Okay, I'll see you soon.
thank you.
Well, it was great meeting you both. I just want to let you know that I won't be back until next week, but I will be in touch with Alex and the care team to make sure you guys, or to make sure you, Lynette, get the best care possible, okay?
Oh, thank you.
Awesome. You're welcome. Take care.
Right? Hopefully you can get some food soon.
Yeah, starving.
I understand all of that. You eat a lot.
Yeah, I do.
The Arboretum is like so beautiful this time of year.
Yeah.
Hey, Mom, maybe we can do like a drive-through. I can bring Jesse and Ivy, and they can have some grandmama time.
Oh, I'd like that. Yeah. Come in.
Hi there. I'm Dr. Jill Peterson, and I am a dentist on your healthcare team.
Okay.
And I'm Jay. I'm your dietitian. I'm guessing you guys are Lynette and Christine.
Yes.
Hi.
I will try to remember your names, but I don't promise.
No worries. I'm guessing you have met a lot of people being both in the hospital and now here.
So many people.
Well, I hear that you like food, and we
Ah.
are here to help with that. Is that something we could talk with you about now?
You're my new favorite people.
That's great. We won't tell the others. Lynette, I hear you're really hungry and that you're having some tooth pain right now. Has that changed the food choices you've made, and what kinds of foods are you eating?
Well, in the hospital after a stroke, soft foods, and before that, my favorite is pizza and fried chicken.
That's what we hear from Dr. Johnson and Alex.
Yeah.
But they also mentioned to me that you might be willing to try some other foods right now.
Yeah, maybe some soup.
How about some vegetable soup?
Did you say vegetable?
Oh, sorry, you might have to speak a little louder.
Oh yeah, vegetable soup. And we can have Alex bring some in here as soon as we're finished.
Great, I'm starving.
Yeah, that sounds good, because this is important for you not to have crunchy and chewy foods until we can do a thorough dental evaluation.
Okay.
And it's important for us to be able to alleviate your mouth pain. We will work together, and I will address some of the issues you're having with your tooth, and Jay will talk to you about healthy food choices that will also support your oral health.
Yeah, I'd like to give you some ideas about soft foods that you can eat now, as well as some general diet tips from when you're able to leave here and go home that will help you to stay healthy at home. How does that sound to you guys?
That sounds great, actually. Mom does need to have a healthier eating plan at home. We talked about her eating healthier, right, Mom?
So I promised that to my daughter that I would try, and I always keep my promises to Christine.
Yes, you do.
Well, then we will have some vegetable soup coming up right away. After you've gotten a chance to eat, I will come back in and we can chat a little bit more about other food options as well.
Oh, it's good. Sounds good. Ah.
And I will be back after you've eaten, and we'll do an initial dental evaluation to see what's going on, and hopefully get you feeling better soon.
Okay. Yeah.
All right, well, we will see you guys back in a little bit. Thank you so much.
Thank you.
Appreciate it.
Okay.
Thank you.
Bye-bye.
Bye.
Oh, Mom, that's great. You finally get to eat something.
Oh, I'm starving.
Let's get back to planning our Arboretum outing.
Okay. After we drive through, how about some apple cider donuts?
That's probably a lot of sugar.
Well, they're soft, and the kids would love it.
They actually would. How about we wait about 2 weeks to see what Jay has to say about it?
Okay.
Hi, Lynette, I've got your soup.
Oh, great. I'm starving.
Good. I got some vegetable soup here for you.
Okay.
I'll wheel it right over.
Thank you. Oh boy.
And before we eat,
Huh?
I need to ask when you normally take your insulin at home.
Insulin, well, I say, when I get home in the restaurant, sometimes late, and sometimes I'm so tired because I have to stay late and close. So sometimes I forget.
See,
Yeah.
Mom, we've talked about this. You're supposed to make sure you're on top of this. I can't. I told you like how to set up an alarm on your phone. It's really easy. I can't call you every day to make sure you're taking your insulin. I got Jesse and Ivy to worry about, my part-time job. You have to be on top of this, Mom.
I try. I really will try. I just now feel bad.
Lynette, this is really important in terms of timing. When you take your insulin in relation to when you eat can make a really big difference in helping you control your diabetes.
I didn't know that.
For now, it's okay. Enjoy your soup, and we can work with you to develop an insulin schedule later with the whole care team.
Okay.
Would it be okay if I called your regular clinic so they are aware of the recommendations we're providing for your insulin management?
Actually, I think that'd be a good idea because I don't know what they're recommending, Mom.
Yeah. Okay. Yeah, you could.
Okay, great. I'll give them a call. Enjoy lunch, Lynette. And when you're done, I'll send in your occupational therapist and your physical therapist.
Thank you, Alex.
You're welcome, Lynette.
Thank you.
Okay.
Hey, I can read to you while you eat.
Yeah, I'd like that.
Ooh, look at this, Mom. There's a garden display. Oh my gosh, you really work. Looks like, ooh, they have an all dogs day. I think we can take the dogs out with the kids. That'd be really cool.
Oh,
I
yeah.
love it.
Oh, come in.
Hi, Lynette. I'm Jamie, your physical therapist.
And I'm Carrie, your occupational therapist.
Hi. I wonder, two therapists. Why two therapists?
Oh, also, can you speak up a little bit? She's having trouble hearing. Also, I'm Christine, her daughter.
Absolutely. I'm Jamie, your physical therapist.
And I'm Carrie, your occupational therapist, and we get that question all the time.
Yes. As your physical therapist, my job is to help you to get your body to move better.
And as your occupational therapist, my job is to help you do the tasks of daily living more easily. For example, eating is a task you're doing right now. My job is to help you do that in a way that's best for you.
So, as you can tell, our jobs are different but related because in order to do those activities of daily life, you have to move your body in order to eat and get dressed.
Makes sense.
Yeah, I appreciate the overview. That was good.
Yeah, no problem. So, how's the eating going?
Slowly.
Yeah.
Mom is using her left hand, but she's actually right-handed, so it's kind of hard for her.
Would you mind showing us? Do you need any help?
No, Christine helped me to eat if I need help or brush my teeth. She's my daughter, so.
Yeah, it's hard to ask for help, especially from a stranger, especially when you're so used to being independent. So I understand completely.
I think it's great that you want to do things for yourself. I mean, that type of motivation, it will really help you get your strength back. And that is so important for recovery.
I definitely want to do it myself.
That's great. And speaking of recovery, we could actually get out and go for a walk today. I could show you around the building, give you a tour of the facility.
I don't know today. I don't feel just up to it yet.
Yeah, I mean, we did try yesterday afternoon, and it was kind of difficult. We want to get her moving again, but maybe she should have a little bit of rest today.
Absolutely, that makes sense. So we'll put the walk on hold for now, but it's great to know that you want to get out and walk, because my goal is to really help you get confident in moving your body with the walking and such.
Thank you. I want to walk and to do it on my own, and I thank you for being patient with me.
Yeah.
Absolutely.
Yeah, and our goal is to help you reach your goal of living your life as back to normal as you lived it before.
That's my goal too. I mean, that's
Yeah.
what I want to do, get back to normal.
Right. And some of those steps might take longer than others, but that's okay.
True. That's true. So with that, we will head out for today, but we will come back around tomorrow, check in, see how you're doing, and maybe you'll be up for that walk then.
Okay, thank
Okay.
you.
Great.
See you.
Thanks.
Okay.
Nice to meet you, Christine.
Appreciate it, thank you.
Bye.
So Mom, how's the soup tasting?
It's okay.
You like it?
Yeah.
Okay, well that's good. I think I see Nurse Alex out there. Would you be okay for a little bit if I go talk to him?
Oh, yeah, sure, honey. Yeah, I think it'll take me an hour to eat the soup.
Okay.
Okay.
I'll be right back.
All right.
Hi, excuse me, Nurse Alex?
Yeah, hi Christina, is everything okay?
I didn't want to say this in front of my mom, but how long is she gonna be here?
It's hard to say right now. We're monitoring her closely and we're continuing to develop her care plan. We want her to be comfortable while still making progress in her recovery goals.
Okay. The thing is, and I feel terrible saying this, she has limited insurance coverage. We can't afford for her to stay here very long. I mean, she really likes it here, but we need her to understand that she needs to put in real effort towards her recovery. How can we get her to understand that and to help her get out of here quicker?
I understand. Everyone recovers at a different rate, so I can't give you a concrete timeline. But we do have some excellent social workers here. Their job is to help patients and families understand what resources are available to them, including financial ones. So they can work with us to make sure your mom has a safe care plan, and with you to best manage the financial resources available to support that care.
That's great. Could we have a social worker come meet with us?
Absolutely. And we will continue to do everything we can to make sure your mom recovers as quickly and as safely as possible.
Thank you so much.
You're welcome.
I appreciate it.
Yeah, have a good day.